So we go to quality improvement activity. This is one area that throws a lot of GP trainees for a loop. One, because they think about it quite late. That's from my experience with my colleagues. They think about it quite late. Most times it's a couple of weeks to their CSR meeting, which is what I'll also talk about very soon. So now for GP training, you need to be involved in a quality improvement activity at least once a year. And then in your second year, you now have to do a quality improvement project. Now, they are two different things. A quality improvement activity is anything you do, any little change you make that makes a change in the practice. I'll give an example. In my first year of training, I did a quality improvement activity on respiratory referrals. I had been thinking of what would I do? And then one day I wanted to do a referral to the respiratory team. There used to be this like something pasted on the wall of the doctor's room that was the referral email. So I sent the referral to that email and it was bounced back. And then I started calling the respiratory reg and he said that email has been out of date for about 6 months and that I should send to this particular email. Right. So I said, and it just snapped in my head. This can be a QIA. So I went to the ward clerk and I said, if this thing pasted on the wall here is out of date, we're having problems communicating with respiratory, I would like to change it. So what we did was I got the new email. We printed out a new SOP for that, saying this is who you contact for respiratory referrals. I sent out an email to all the doctors in the ward, everyone working in the ward, and then pasted that on the wall. And after that, we noticed that once we send the referral to that email, before the end of the day, they come and see the patient. That was a quality improvement activity. So it's not something big. It's anything that made a change where you're working is a quality improvement activity. Now, so when you want to do that, you click on new quality improvement activity, and then you put your title, you put your brief description. What were you trying to accomplish? In my case, it was for smoother referral so that it improves patient care. Patients are seen faster. That makes sense. How have you engaged with others? So obviously, in my case, I engage with the ward clerk, I engage with my colleagues, I engage with the nurses and the ward matrons. What changes have taken place? Smoother, seeing patients faster, better communication with other members of the team and other members in the hospital, and then reflection. So it's something that even as you're writing your clinical case reviews, anything that made a change, it might even be updating the phone numbers of all bleeps. If you're in hospital, for example, and there is a paper where all the phone numbers of bleeps change every time. It might be updating the phone numbers of all the bleeps on your ward and pasting it on the wall. That's it. So that is for a QIA. In QIA, now just coming back to the capabilities, there are some capabilities that you may have difficulties getting things to link into them. So for QIA, for example, capability like organization management and leadership could help. Now, if you look at what descriptors here, you can see that if you look at the word descriptors here, you can see, for example, if you look at this, first of all, I do apologize, I don't mention this before. What helped me in GP training is when I look at the capabilities, you see different levels. You see indicators of potential underperformance, needs further development, competent and excellence. So I always looked for wordings that stood in the columns of competent and excellent, if that makes sense. So from the example I gave now, so you can say leads and supports change in the organization, involving and working with the team to deliver defined outcomes. So by changing that referral connection, I was able to lead and support change in the environment. So that means I can confidently use the capability of organization management and leadership in that case. Another capability you can use, which people find it difficult, is also team working. This one is a no-brainer. Once you go and discuss with anyone in the team, I said the ward clerk, I said the nurses, you can also take the capability of team working. Okay. So another place where you can use organization management and leadership and team working is in your leadership activities. Okay, so anything that you had to discuss with someone else, other members of the team, you can use that. So those were the capabilities I used, to for that particular example. Does that help? So that is for a QIA. So it's something you keep in mind so that you are not rushing to get it sorted. These are things that if it's not done before the end of your first year of training, it can give you an extension or something like that. And I'm sure that so further details on this would be in your course, and there will be a demo template for you to have a look at. And you can also visit the RCGP website to see more examples of quality improvement activity and tailor it to the rotation or the posting that you're doing at the time.
Brilliant.